Hello everyone, you're watching sqadia.com and I am Dr. Hamad Haider. Today our topic is Degenerative Disorders of Spine. In this we'll be discussing briefly the spondylolisthesis and we'll be discussing what is spondylolisthesis or vertical slip and what are the different causes of vertebral slips and how do we classify it. From classification of that is Neumann classification as well as Merding classification, we'll be moving on towards the what are the signs and symptoms of spondylolisthesis, and then what is the imaging which we need to do, what to look for on x-rays of lumbosacral spine, especially the AP and the lateral view, and how to judge the segmental instability as well as how to grade the slip which is actually occurring. From then we're moving on towards the other imaging which may be required, for example MRI as well as the CT, to look for the specific form of spondylolisthesis such as the isthmic or dysplastic type, or how to assess the narrowing of spinal canal or spondylolisthesis which may be eventually leading to some form of spinal stenosis. From then onward, we will be discussing the conservative as well as the surgical treatment of the spondylolisthesis. Usually the initial treatment is always conservative, but then we'll also briefly discussing what is the specific surgical treatment for spondylolisthesis, which may include anterior interlumbar for diffusion or posterior intermittent fusion without decompression or posterior intermittent fusion with decompression. We'll also be briefly discussing the TLIF, DLIF and DDR as well, which may or may not be usually done, and usually it's rarely done for spondylolisthesis, but as it is sometimes done, we'll be briefly going through that as well. From then onwards, the next topic we'll be moving on would be the spinal stenosis. As you know, the spinal stenosis is actually the narrowing of spinal canal. This could be due to multiple causes. We will be briefly discussing what are the bony causes which narrow the spinal canal, and then we'll be briefly discussing what are the soft tissue causes which narrow the spinal canal. And depending upon what is actually causing the spinal stenosis, we will be briefly classifying the spinal stenosis into the central, lateral recess or subarticular, foraminal or far lateral stenosis. Then we will also be moving on to, once we have checked out the signs and symptoms of spinal stenosis and how do patient actually presents with these problems, then we'll be discussing what to look for on imaging, especially what to look for on X-ray lumbosacral spine, AP and lateral view, what to look for on the MRI, as well as how to classify whether it is foraminal stenosis, is it central stenosis, is it lateral recess stenosis, or is it far lateral stenosis. We'll be viewing the imaging, how the foramina appears stenosed on the MRI and what exactly the foraminal stenosis looks like. Then we'll be discussing how exactly on the MRI you judge whether it is a lateral recess stenosis or not. From then onwards, we will be briefly discussing the concept of traversing as well as the exiting nerve root, and we'll be discussing whether there's what are the different types of stenosis which affect the traversing nerve root and what are the different types which actually affect the exiting nerve root. Then we'll be discussing the treatment regarding the surgical options for spinal stenosis, whether it is central stenosis, it is lateral recess stenosis, or is it foraminal stenosis. And we'll be briefly discussing that why this treatment is actually usually preferred, because depending upon the cause of the stenosis, usually, for example, if we are talking about foraminal stenosis, the most common cause is actually narrowing of the foramen. If we are not going to deal with the foramen, then probably the foraminal stenosis will not go away. Therefore, we'll be briefly discussing what is actually the actual cause why these surgeries are done in this type of a stenosis. From then onward, we'll be discussing chronic back pain syndrome. As you know, that chronic backache is a very common symptoms and it's a very common presenting complaint as well. I will be discussing how we can assess a patient and how to take history of a chronic backache and what to look for an examination, then so that you can narrow your diagnosis, and how to make differentials of chronic back pain syndrome, and then what is the treatment? Treatment is always directed at the cause, which is actually causing the chronic back pain syndrome. So you're not treating the chronic back pain syndrome, but you're treating the underlying cause. And this could be anything, right from the infections up till the metastatic disease, from spondylolisthesis, disc prolapse, disc herniation, or even the instability as well. So depending upon what is actually causing the chronic back syndrome, the treatment is always directed at the cause. If you want to watch more videos regarding spinal surgery as well as orthopedics, go to www.sqadia.com and watch all the videos over there regarding orthopedics. And if you want to watch the videos of any other subject, whether it's other orthopedics or any other subject, you can go to sqadia.com and watch all the videos over there. Thank you very much. Keep watching sqadia.com.